This podcast is supported by IHI, also known as the Institute for Healthcare Improvement, who have been improving health and healthcare worldwide for 30 years. Did you know a recent IHI industry poll found that health equity is now a top priority for 68% of respondents, compared to 25% in 2019. That's nearly a threefold increase. IHI is working to accelerate the elimination of health inequities in the US, UK, and around the world, and you can be part of it. Visit IHI.org to download the full IHI Health Equity Report and join them in their goal to achieve health equity globally. While you're there, check out the many other tools and free resources available from IHI, including QI tools, white papers, and patient safety tools, to name a few. That's IHI.org. Together, we can achieve health equity. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, what topic or question are we going to take on this week?
Well, John, the question is, what was the cause of the mask mandate ending? And what I have to say is, everyone had to wear their masks on the plane until all of a sudden they didn't. There was an inexperienced.
Well, there wasn't a real cause. This is the whimsical decision of an underqualified, barely qualified, recently appointed judge. I mean, what do you think's behind this?
Well, I mean, there was clearly the plaintiffs were looking to overturn the mandate, and so they found a friendly judge in the right venue in Florida. And she said that the CDC exceeded its authority in ordering masks to be worn on airplanes and other forms of public transport. And so the mandate ended immediately, even in the middle of a flight. The CDC has actually not changed its guidance, and they still say that masks should be worn, but now they've lost their authority to enforce the guidelines.
I mean, this is really a great example of how the convergence of what's politically attractive for one party is undermining the broad agreement that historically, folks have, that public health has been a nonpartisan, bipartisan issue. This is a terrible precedent, but this is just the dull end of the spear of the right wing trying to find a way to attack government in general. But unfortunately, really vulnerable people, I think, are going to suffer, David.
Well, John, I would say who overstepped their authority here, it was the judge. It's really about the kind of a crusade to dismantle the so-called administrative state. And that means taking away the ability for agencies to interpret the federal regulations and instead making individual judges make the decision. In this case, the judge focused on the word sanitation, and she took it, with a definition from now and not from when the law was written. And that was sort of a very flimsy basis, but that's what she used to overturn the authority.
Well, sanitation goes back to some of the very foundational views of what it means to be an effective public health executive. It means you want to create a healthy and hygienic environment, starting with clean water and clean air. And the CDC, in the middle of a crisis, can't be kind of hamstrung by individual, or should not be hamstrung by individual judges. And let's give some context here. We're in the midst of a BA2 spike. We've got much better therapeutics. We've got much better vaccination rates. People are getting boosted. Deaths and hospitalizations are still going down. They're still happening. And we're in a little bit of a mini spike. The test positivity per 100,000 population has risen in the last couple of weeks. And you're seeing in particular hotspots in the Northeast for this BA2 variant. The CDC is losing a tool. Now, I think the mask mandate was going to be either reduced or stopped anyways. That's sort of the whisper. But heck, Philadelphia 2 weeks ago just put a mask mandate back in. We have to have a situation in the middle of a public health crisis where individual public health authorities have the authority to enforce public health based on the best information available. I think this is a terrible precedent, David.
Well, John, I think it's up for debate whether to have the mask mandate and what sort of form. But I don't know why anybody would want this to be decided by individual judges. It should be decided by the CDC, and it's within their authority. So I think everybody knows how we feel about this judge and this sort of approach. Let's talk about the mandate itself, John. I think it's worth drawing a distinction between whether masks work and whether a mask mandate works. Because I know a mask will work for an individual person. Physicians wear masks in the hospital, and nurses, and 95 masks will protect them from a patient who's sick and shedding virus, even if the patient doesn't have a mask. And then the question is, what happens when you transform that into an overall public policy and have everybody wearing a mask? That's going to be less effective, and maybe it needs to be more focused or for a certain time period. But I think that's a discussion worth having about the mandate, but masks work.
Well, there's no question that masks work. Even simple cloth masks that people were putting together at the beginning of the health crisis provide like 48% less likelihood of getting infection. If you have a surgical mask, those light surgical masks, even though people bemoan those as maybe not being as effective as the most effective KN95, that probably lowers your infectivity to less than 40%. And if you wear a well-fitting KN95, you're like 90% less effective, to your point, of getting infected. Look, there's a lot of public health mandates that are going to be uncomfortable, and there is a pushback about schools. There's obviously a lot of irritation and politicization around this mask stuff. I mean, the reality is people get tired, and if you look at pandemics over time, often the need to extend the public health decisions extended well beyond people's patience with them. That was certainly true of the Spanish flu of 1918, where it came back with a vengeance after people had backed off of a lot of public health measures. But unfortunately, this bug's not done with us, and so I really think you're making a real point. And the reality is, look, if people don't support things at a broad level, even though the polls would suggest that the vast majority of Democrats, for example, did support the CDC and the government's mask mandates, it has become super political. And if people aren't going to follow the rules, I guess it makes sense to change them. There has to be some public support. But I don't think we should back off this notion that the decision should be made by doctors and public health professionals. And those decisions may move around. They may change over time.
Yeah, I mean, the CDC is accountable ultimately to the president, and to Congress, and those are elected officials. Whereas, if a judge is just going to make some decision, she was placed on the bench when she was 33 years old. She could be, in charge of public health for the next 60 years or 70 years. If public health keeps up well, she could live over to 100 and more and still be telling our great-grandchildren what to do. So it's a real problem, I would say, John. John, what has been your own experience with masks? Are you a mask man yourself?
I'm a believer in masks.
Yeah.
I'm a believer in masks, particularly if you're in areas that are poorly ventilated, like a subway or an older building. I mean, one of the things we really haven't focused on as a public health command is really think about ventilation differently. But there's whenever I'm in a very big public area, particularly when I'm moving around, and whether it's on a flight or a subway or a bus, I'm going to be wearing my mask. I'm going to be sporting my mask. What about you, David?
John, in the early days of the pandemic, when all of a sudden you couldn't get a mask, do you remember those days? I actually had a mask because I'm even fairer skinned than you are, John, and I don't have any hair either on the top of my head. So I had a mask from a company that I use for sun protection. So I had a mask to start with, and that was actually a comfortable mask. I had some good masks. I actually like some masks that I got from Korea that are very kind of lightweight masks, and they do a good job, and they're not uncomfortable to wear. So I've been wearing masks. Luckily, I can mostly work from home, as opposed to my wife is a school teacher, and she was in the school throughout the pandemic and wore a mask all the time, and it was hard, but she did it.
Well, I think as a practical matter, we should make the point that even though hospitalization and deaths are down, that you are 97 times more likely to get very sick with COVID if you're over the age of 65. That there are vast chunks of the American population that don't have great results from when they get sick with COVID. Anyone with diabetes, anyone with cystic fibrosis, anyone with COPD, advanced pulmonary disease. There are a lot of major diabetes, obesity, there are metabolic syndrome. There are a lot of folks who are in medically fragile or vulnerable states who are much less likely to be protected by the things like vaccines that the rest of us are well protected by. And I think we all ought to be try to be responsible, not just for what irritates or is part of our life, but how we actually protect the most vulnerable among us. And that is really one of the mandates of the CDC. And I think it's one that frankly, this judge has no interest in supporting.
John, one of the other things that has happened is maybe not as apparent to people outside right now, but the nurses and doctors are just completely exhausted and burned out from 2 going on 3 years of the pandemic. And a lot of the public health measures were designed so that the hospitals wouldn't be overwhelmed. And it's not just COVID patients, but if somebody has a heart attack or a stroke, they haven't been able to get timely care. And it's just been really a lot too much to ask, frankly, of our healthcare providers. To be able to put up with people that are just say, I don't want to wear this because it's not comfortable for me. I don't feel like it, or it's bad politically. So we owe it to them.
I don't know how we're going to get underneath that issue of clinical burnout. Maybe that's a topic for another time.
It could be.
But doctors' depression and suicide and drug use is up. A bunch of nurses, as we covered in an earlier episode, want to quit. I would think that one way that we can clearly support folks who are on the clinical front lines of fighting this disease, and frankly, fighting disease in general, would be to help protect them by wearing masks in area at times whenever there's a infection rate or test positivity rate starts to pop in our areas. And obviously New England's a hot spot right now. But this bug's not done with us, and we need to make sure that we're doing everything we can to support clinicians.
So, John, last question for you. Where is the pandemic heading, and how does this ruling affect where it goes?
Well, last part first. I think this is a crass and stupid example of the politicization of public health. I don't think we can do anything about it. I think it's, to your point, like there's the support for the mask mandate has eroded, particularly as hospitalization and deaths are down, and we're in a new phase of managing it. But I think that COVID will be with us, and it's our job to find, in a multi-layered way, ways to deal with this drug. We've got great therapeutics that you can take if you're vulnerable and you do get sick. There's broad access to that. There's new therapeutics. Those are treatments for you if you get COVID. There is extraordinarily deep and broad evidence that vaccines and boosting really do help. And we still got a bunch of populations we need to get vaccinated. And I think that we are getting, hopefully going to go a little bit deeper on for those 5 to 15% of people with long COVID, which is a kind of a multi-threat disease that we're still trying to get our arms around, that we will find ways to actually help those folks recover. But I just think this is not going to be a one and done thing. I think it has every evidence that it's going to be seasonal and annual, and will continue to mutate. Vaccination rates are really low abroad, and so I think I suspect this bug will continue to mutate, and we'll continue to get better at managing it and living with it.
Well, John, I hope that what's going to happen is that the new variants will be like the recent ones and become, milder, and even if they're more contagious. That would be nice, but there's no guarantee of that. I do believe that as we have other problems with the pandemic and new things that we don't know about yet, and new pandemics or viruses, the CDC and other agencies are going to be potentially hamstrung by this decision. I do hope it's overturned on appeal, and let's leave it at that. So that's it for another edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you liked what you heard or you didn't, please subscribe on your favorite service.